You called birth control pills, and I'm going to quote, a disrespect of life.
I'm curious if you're aware of what the side effects of hormonal contraception are.
If you are with the FDA that went through all of these and rigorously looked at them, or as Surgeon General, if you're going to tell the truth to the American people.
I absolutely believe these medications should be accessible to all women. Some of the horrifying side effects of birth control that I have mentioned include blood clots and stroke risk in women.
Do you stand by what you said in your book, encouraging people to try psychedelics?
I think the science is still emerging, and so it would certainly not be a recommendation to the American people to do that under no circumstances.
As Surgeon General, should you be confirmed, how would you speak to the American people about the use of illicit drugs?
Recommend that to the American people in this role. Our illicit drug use problem in our country is monumental and severe, and I look forward to working with you on these issues that are so important.
You called birth control pills, and I'm going to quote, a disrespect of life, and you said Americans, quote, use birth control pills like candy. You also claimed, contrary to established science, that hormonal birth control has, quote, horrifying health risks for women. Now, here are the facts. There are 18 FDA-approved contraceptive methods, both hormonal and non-hormonal, and there are decades of evidence showing that every one of these birth control methods is safe and effective. So I wanted to ask you, help me understand, should women trust the FDA, which approved all 18 methods of birth control after a very rigorous look at the evidence, or should they trust your statement that there are horrifying health risks to birth control, which contradicts that evidence?
Thank you, Senator Murray, for your question. I'm curious if you're aware of what the side effects of hormonal contraception are.
I'm curious if you are with the FDA that went through all of these and rigorously looked at them, or as Surgeon General, if you're going to tell the truth to the American people.
I absolutely believe these medications should be accessible to all women. And also, all medications have risks and benefits, and in our current medical climate, with the burden on doctors, doctors do not have enough time for thorough, informed consent conversations. Some of the horrifying side effects of birth control that I have mentioned include blood clots and stroke risk in women who have clotting disorders, who are smokers, who have obesity. No, it's not general. I'm very careful with my words, and when I say those comments, which are taken out of context, I'm speaking about particular women that can be hurt if there is not informed consent about their medical history, their lifestyle exposures, and their family history. I want those women, and I know you do too, to be able to have a thorough conversation with their doctor and know whether they are at higher risk for side effects when prescribed the medication.
Saying that is one thing, but saying on different shows that birth control pills are a disrespect of life is very different.
I am passionate about women's health, and I think it is disrespectful
people use
to women.
Birth controls like candy is very different than what you just said.
We prescribe a huge amount of hormonal contraceptive, and I do not believe most of those conversations have informed consent because of the pressures that doctors are under because of our broken healthcare system. I want what's best for women, as do you, and I want every woman who could be at risk for a side effect.
2 minutes left, and I have other questions. Let me move on. Thank you.
If a woman died from a stroke or a blood clot because they did not have a thorough conversation.
Thank you for your answer. You made that clear.
I'm concerned that in your book on good energy, that you urge readers to consider psilocybin-assisted therapy. You also said that you were inspired to try psychedelics in what I can only describe as an internal voice that whispered, "It's time to prepare." Illicit drug use remains a huge problem in this country, and this didn't happen in your teen years. According to your book, in 2021, you began using illicit psychedelic mushrooms. So my questions to you are twofold. One, Do you stand by what you said in your book, encouraging people to try psychedelics? And second, as Surgeon General, should you be confirmed, how would you speak to the American people about the use of illicit drugs?
Thank you so much, Senator Collins. And I also thank you sincerely for engaging so deeply with my work and learning about me. This is a very important question. And I would start by just saying that I believe what I would say as a private citizen is in many cases different than what I would say as a public health official. Joining a team where the purpose of this role is to communicate absolutely the best evidence-based science to the American people to keep them safe, thriving, and healthy. And when it comes to psychedelic therapy for mental health issues, I think the science is still emerging. And so it would certainly not be a recommendation to the American people to do that under no circumstances. I do believe that there is exciting work being done in this area that needs to continue on psychedelic therapies for PTSD and veterans, for mental health issues. And some of the researchers who are doing this work have said it's some of the most promising and exciting of their entire careers. So I look forward to following that, but to be very clear, under no circumstances would I recommend that to the American people in this role. Our illicit drug use problem in our country is monumental and severe, and I look forward to working with you on these issues that are so important.
What did you mean by saying that you heard an internal voice whispering to you saying it's time to prepare?
Yeah, in that passage of the book, I'm referring to my mother's passing, which happened. She got a diagnosis of pancreatic cancer about a week after that experience. And in my meditations and prayers at that time, I was having a deep sense that something ominous was coming. And so that's what that's referring to. I think when I speak of spirituality, and, I do believe Americans are ready to hear about spirituality as it pertains to medicine. 80% of Americans are spiritual or religious. There's amazing evidence coming out of Columbia University, the lab of Dr. Lisa Miller, that spirituality has a large impact on health outcomes. And, so certainly that's a personal anecdote. But I again am committed to sharing only the best solid science with Americans on how to be healthy.
I understand totally what you're saying about spirituality, and I'm sorry about the loss of your mother. It's the link to illicit drugs that I'm having a hard time with.
Subscribe to One India and never miss an update. Download the One India app now.